So, we discussed a little bit about how there's uncertainty in pretty much every medical context. Now, though, we need a constructive solution. We need to be able to take this information and apply it in a practical way. So, to talk about our appendicitis example from before, let's say we bring that patient back into the mix and we have our patient here who has suspected appendicitis, and we know that no matter what, perhaps we could be wrong. Perhaps this would not be appendicitis. Even if we get the histology, even if we get the CT scan, no matter what, there will always be this degree of uncertainty. But for practical purposes, when we approach this patient, we have to decide for ourselves, what is our threshold? How low does our uncertainty have to be in order for us to say that this is appendicitis? Because at the end of the day, we do have to make a diagnosis. We do have to tell the patient something. We have to address what has been giving them their abdominal pain, and really to just have some degree of closure. We have to say, we believe you have appendicitis, or we believe you have something else. In the case of this patient who presents in this particular way, and there may be different opinions on this, but one example of where you could set the threshold is say, okay, we have the clinical presentation of this particular type of abdominal pain. Perhaps if we have this plus the CT scan showing the inflamed appendix or patterns that we believe to be consistent with appendicitis, then we have reached the threshold for taking this patient to the OR and operating on them. And once we've done this, we will get the histology no matter what, because we're going to take the appendix out, and we'll be able to address it more later on. But the decision-making point, really kind of when we commit to this appendicitis pathway, is here, after we get the CT scan. And even though we could be wrong, it is possible that we go in there, we notice that there's something else going on. Maybe there's a parasitic infection of the liver, and that was the real problem. Regardless, we have decided for ourselves that if we have a clinical scenario and this CT scan imaging to kind of reinforce that, that fulfills our personal threshold for minimizing uncertainty, and we're going to commit that patient to the OR. Again, this is just one example. Different individuals may feel, even on the topic of appendicitis, that there should be a different threshold, but it's all about us being very, very intentional. Thinking about all the tools we have at our disposal for minimizing uncertainty, and then deciding for ourselves and for the patients when we're going to pull the trigger. At what point do we say, yes, this is what we think the diagnosis is, and we're going to take care of it. In this case, this is when we think it's appendicitis, and we're going to take it to the operating room and take that appendix out.